Hello, all. I hope you can hear me. So, we are going to start with the orientation session. So, after you clear the part one, you come across the part two and you feel very overwhelmed because you have no idea what to do and where to go, whether you need to buy any coaching or not. So, we are going to discuss all the parts regarding the part two from here. So once you clear your theory exam, the part two having a 3 years validity. So if you clear your theory exam, you have to clear the part two exam within 3 years of the period. Otherwise, your part one will be in like the validity will be over, and you have to give your theory exam again. So if we go from the part to part, what exactly the part two where you need to give the part two exam? And what you required, what armamentarium you required, everything we are going to discuss over here. So once you clear your theory exam for the part two, you have to be in the Melbourne. So to because the exam is taken in the Melbourne, and for that, if you are an overseas candidate, you required a visa. So for the visa, there are two categories. One is the visitor visa and one is the business class visas. That allows the multiple entries and it has the maximum 3 months stay they allow. You do not allowed to do any work in those 3 months period. So if you want, you can request the ADC. They give you the mail regarding the exam that can help you for getting the visa and try to attach all the required documents because we have seen many candidates getting the visa rejected multiple times. If you apply for the visitor visa, you have the validity of the 3 years, and if you get the business visa, it has a validity of the 5 years. For the business visa, you can see so any conference exam letters is also okay. For the visitor visa, if you do have any relative over there overseas, you can attach those recommendation letter or the visiting letter with all the documents needed. And apart from that, you can also attach your ADC letter with the things required in that particular visa category. So we are going to discuss in detail about the part two over here. Okay, I hope everyone can see the screen now. Okay. Good. For the exam, you have like a 2 days exam. One is the technical skill days and another is the clinical skill days. So the exam fees is nearby 4675 AD. Once you get your theory result, after like a few weeks, you will get the mail from the ADC once the practical exam dates open. So you comes under the category. There are two stage one and stage two categories. You comes under the stage two categories. It means you can apply for the exam and it will be accepted on first come first serve basis. The stage one category is for those whose theory is about to expire. So whenever they open the application period or the fees period, try to submit your application immediately for the practical and try to submit the details for the fee processing because sometimes it gets full within 1 or 2 days. So you don't want to risk your chance to miss for the applying the exam. Try to be aware about the time difference because they start nearby 11 or 12 o'clock of the Melbourne time. In the overseas, the time will be different. So keep on understanding all this part why when you apply for the exam. Okay, they will mention on which date they will open the prayer for applying the exam. So on that particular day, be on your laptop or the device, you whatever you choose, if you want to apply for the exam and don't want to miss the chance. Once you apply for the exam, within few time, within few weeks, you will get the reply whether it's accepted or not. After 4 to 6 weeks, they will open the period in which you can select the date. For selecting the date within the time frame they have given, also try to be on. Also try to be mindful regarding the time difference if you are an overseas candidate and if you want to select any particular month or dates, because that also serves on first come first serve basis. Once you select your dates and everything, before 1 month, you will get the schedule, whether you are having the technical on the first day or the skill OSCE on the first day. So, what exactly the technical skill days and the clinical skill days? The technical skill days include the six different tasks. Okay, that includes the preparatory cluster and the restorative cluster. And the clinical skill days include 6 OSCE station and 4 skilled OSCE stations. So there will be like a 10 station totally on the clinical skill days. We are going to discuss first the technical skill days. What are the tasks you are going to get? So on the preparatory cluster, there is a carious tooth preparation, crown preparation, and the endodontic access cavity. On the restoration based cluster, there is a complex amalgam restoration, provisional crown restoration, and resin composite restoration. So what you exactly needed for the home setup, the basically you need a portable dental chair unit with the air compressor. If you are already a clinician, you do have it. The cow handpiece, if you can get, it's best. Otherwise, you can use the NSK handpiece. The air pressure you need to keep is like a 25 psi because during the exam you feel the pressure is very low. Loops, it's good if you can use the loops. Any loops you can go for, whether from the Amazon or the Orascoptic, based on your financial situation. Okay, well, which think you should go from the one dental? So mannequin, I think you should go from the one dental or Nevada if you are overseas. Then there are Columbia Dentoform jaws. Fletcher, I recommend Fletcher, Endoteeth, and Carious teeth from one dental only. What are the different dealers are there? In the Australia, you do have the dental market, or you can contact the local dealer and there is one dental. If you are overseas, there is a Nevada, there is a dental cart or whatever local dealer is there. You can contact for some materials. So you can get it on the cheaper rate. So for the crown, first task you can get is the crown preparation and the provisional restoration. So here we have mentioned the teeth that has been asked till now in the exam. So they can add on any other teeth also, but there will not be more than 32 teeth, right? So this is just to give you the example which teeth has been asked till now in the exam. So what exactly you require for that particular task? What are the bird categories you required? And once you done with your crown preparation, you should go for the provisional restoration, right? So what material you require for the provisional restoration is also mentioned over here. So how exactly your crown prep should look like? This will give you the basic view. This comes to the end result after doing so many preparation of the tooth, okay? So it requires so much time to be at this level. It's not about how it looks. You should also fit in the criteria. Okay. So in Australian Dental Achiever, in our academy, we teach you everything, how you need to do that particular task so that you can fit into the criteria. there are different criteria. So try to be in the satisfactory criteria, because when you try to achieve the based one, there are high chances that you might miss some point. So the satisfactory criteria in the crown prep say that the buccal margin should be 1.2 to 1.5 mm. But if you try to fit in the base criteria, it say it's 1.2 mm. So if you are going to completely come on that point, and if you are keeping it 1.2 mm, and in the exam maybe 1.1 mm is less, it can directly lead to the unsatisfactory criteria. The under reduction will lead you the unsatisfactory criteria. So try to be in the satisfactory category, that is 1.2 to 1.5 mm on the buccally and 0.5 mm to 0.8 mm lingually. So in the academy, we teach you how exactly you need to do that particular task. So, what criteria you need to follow and how to follow those criteria. What are the steps you need to follow for the crown prep? Which birds you in which number of the birds you required, and each in which sequence you required. Okay, how to prevent damaging the tooth and the gingiva. Everything we are going to discuss. How you can assess your own task. Initially, we will be there for you, because we have seen in the academy the candidates get overwhelmed because of number of the candidates. Here we will give you the attention on one-on-one basis. The second one will be the endodontic access cavity, and these are the things you require for that. Okay, there are three criteria that depends on the shape and size of the cavity. So this will give you the example, or the give you the basic idea how it should be, the access cavity should look like, because the initial three criteria depends on this point only. How the access cavity shape should be, how the access cavity size should be. Try to remember, if underextended, it means there is a roof, and if there is a roof, it leads through the direct field. So there should not be any roof. 0.5 mm to 1 mm overextended is okay, but it should not be underextended. There should not be any gouging. How to prevent the gouging? Okay, how there should not be any scratches on the floor. How do not, what things you need to keep on mind while you preparing the cavity, so you can avoid that mishaps. Everything we are going to discuss in the demo part. Now, the teeth that has been asked till now in the exams are the upper molar, lower molars, and upper premolars. The caries teeth, I suggest you buy the caries and endo only from the one dental. You need to go very slowly for the caries task. Even if you go 0.5 to 1 mm extra, it will lead to the borderline case. So you have to use the slow speed carbide burrs and the micromotors. Now the second is the restorative cluster. What exactly we required in the complex amalgam restoration? So the amalgamator you can buy from Nevada local dealer or the dental cart. If you are in a overseas dentist, you can buy it from the one dental. There is one question that appears in the candidate minds: which capsule I should use, whether it's a GS80 because it's a cost effective. No, try to use the extended carving time Premite 2 spill capsules, because initially you need to learn how exactly you will replicate the tooth anatomy. So for that, I suggest you need some time. So try to use the same kind of capsule you are given in the exam. Once you achieve some level at the task that you are under satisfactory point, then you can increase the difficulty level later on. You can shift to the GS80 capsule, or you can increase the time. So these are the basic materials you require. Uh, these are the two teeth that has been asked in the exam. So in the amalgam we teach you each and every part, how exactly your cavity prep should be, because it also very much important how you prepare your cavity. In the exam, you will get the machine cut cavity that will be very smooth. Okay, so if you are preparing during practice any random cavity that not has the convergent walls, any random cavity you are preparing that will be different from the exam, then it will be hassle for you during the exam. So we'll teach you how to prepare the cavity. The second thing is how exactly you need to apply the matrix band. Even after years or 2 years of the practice, who are giving the exams, candidates still doesn't know the basics, how exactly you need to apply the matrix band and the retainer. So from starting from the scratch, we teach you each and everything, how you pack the amalgam, how you carve the amalgam, what are the criteria you need to be taken care of, what are the common mistakes candidates are doing in the amalgam, leaving the cervical overhang, leaving the cervical debris that leading to the failure in the amalgam task in most of the candidates. So try to how to avoid those mistakes, which things you need to be taken care of, how to avoid the cervical overhangs, what things you need to keep in mind while you are doing the amalgam. If if anyhow in the exam, if the cusp gets broken, how to repair that part. So everything will be discussed in the academy. The second one is the resin composite restoration. Central incisors, lower molar, and the premolars that has been asked in the exam till now. Uh, the packable composite syringe, try to buy Gradia or the Palific if you are not in Australia, because in the exam you get the same consistency. So try to get used to of the similar kind of the consistency. In the composite, the major criteria which you need to follow, because that comes into the aesthetic zone, there should not be any incremental lines or there should not be any debris. Very smooth and shiny surface it should be. How exactly you need to prepare the cavity, especially in the premolar area. In the premolar they ask more than half, like half of the tooth, more than half of the tooth has been gone. Or how you need to prepare in the central incisor, because in the exam they are giving the bevel in the lingual part. So each and everything we are going to discuss and teach you. Okay. So these are the basic materials you require for the ski. Uh, okay, which task you are getting in the exam is the X-ray, perio, rubber dam. Perio in the perio scaling is there, Pitt and Fisher sealant, CPR, syncope, LA, and these are the things you required. Extraction is the in the extraction task you do not need to have the forceps. We will give you the demo of each and every task, how you exactly you need to do the task. Even for the skilled or ski you need to tick some points. Okay, there are the rubrics for the skill or ski that has not been taught till now. So we'll teach you each and everything what you need to do for the each task, which part contains what points, and you need to taken care of those things. Okay, these are the basic things you need for during the exam when you start. From the beginning, try to wear the eyewear or the loops. Okay, do not start practice that later on I will get used to of the loops. No, if you want to go with the loops, go from the starting. From the beginning, first day, try to follow the infection control. Do not leave any sharp unattentive. Okay. So everything we will teach you in the academy. So there are two different courses. One is online and another is the on-site. Uh, because we know there are many candidates who can't travel overseas. Some candidates are doing jobs or having a responsibility, financial responsibility, who can't leave their clinic, and some are having some some females who are pregnant or some recently having babies or having a toddlers. For them, it's very hard to leave them behind and travel. So there are two different kind of courses, that is online and on-site. These are the group details, Facebook and WhatsApp group. Okay. So for, okay. So I hope everything is clear. If anyone is having any doubt, they can contact us.